Morning, everyone. Thank you, Kayla, and greetings to everyone with us for today's webinar on coping with complexity, monitoring, evaluation, and learning approaches for health system strengthening projects. I'm Rachel Marcus, a Senior Health System Strengthening Advisor at USAID's Bureau for Global Health, and I'll be getting us started today. This webinar is hosted by LHSS, the Local Health System Sustainability Project, a USAID flagship project in health system strengthening. And this slide covers today's agenda. Today's webinar will explore, as it says, monitoring, evaluation, research, and learning, or as we call it, MERL, approaches that can help health system strengthening activities to better understand their impact in complex environments where changes are due to many factors, not just the project activity. We're also happy to use this particular occasion to launch USAID's overall series entitled Health System Strengthening Practice Spotlights, a series of short briefs about various HSS approaches that can be used by implementers in the field. We'll start today with opening remarks from Jessie Joseph, Deputy Director of USAID's Office of Health Systems. And then next, our presenters will describe and share lessons about two complexity-aware approaches specifically, contribution analysis and outcome harvesting, topics from two of our first spotlight briefs. I'm also excited that we will have a good amount of time for a question and answer discussion with a broader group of panelists who have experience on these topics, where you can ask your own questions in the chat. So let's meet our presenters and panelists. Rachel DeLong was the lead author on two of those just completed HSS Practice Spotlight briefs on complexity-aware MERL. And she will discuss those briefs and things to keep in mind when using the contribution analysis or the outcome harvesting approaches. Pamela Garrison is a senior SBC advisor in USAID's Office of Health Systems, and she was part of a team that used outcome harvesting as part of an evaluation for a social and behavior change project. And she will share her really interesting experiences from that work. And then joining us for the Q&A discussion, we are honored today to have three MERL experts join us. Ekpenyang Ekendem from the LHSS project, Gulnoza Uzamanova, who was part of a team that used contribution analysis on the maternal and child survival project, and Sani Mbaye, who is using outcome harvesting right now for the African Collaborative for Health Financing Solution project. So a really exciting lineup today with a lot of really great experts on the line to help us think through how we might incorporate and apply these approaches in health systems work wherever you are in your health systems programming. And now, without further ado, I would like to welcome Jessie Joseph. So Jessie, over to you.
Thank you, Rachel, and good morning, good afternoon, and good evening, everyone. I'm delighted to be here for the launch of the Health System Strengthening Practice Spotlight series. As Rachel said, this new series will document effective and often innovative approaches that have been used in health system strengthening programs. The Practice Spotlight series is intended to support USAID's Health System Strengthening Vision 2030 and its accompanying learning agenda. So when I say effective approaches to health system strengthening, I'm talking about approaches that promote the intermediate outcomes of equity, quality, and resource optimization towards achieving better health outcomes. These are the outcomes our Vision 2030 wants health system strengthening activities to focus on. Equity, meaning ensuring all individuals have a fair opportunity to attain their highest level of health, with an emphasis on underserved, socially excluded, and vulnerable populations. Quality, meaning ensuring healthcare is as effective, safe, and people-centered as possible. And resource optimization, meaning mobilizing and using resources efficiently, effectively, and transparently to meet population health needs. The primary audiences for practice spotlight briefs are USAID mission staff, implementing partners, and health systems stakeholders at the country level. Our intention for these briefs is to be useful as you design and refine evidence-based health system strengthening programming and interventions. New practice spotlights will be released every year produced by USAID implementing partners and the Office of Health Systems. The first two practice spotlight briefs, which this webinar will focus on, feature innovative monitoring, evaluation, research, and learning approaches that can be applied to help determine whether and how health system strengthening interventions have contributed to a desired outcome. The next practice spotlight briefs will explore topics such as digital transformation approaches that can contribute to health system strengthening, as well as key aspects of quality improvement. I want to especially thank the members of the advisory committee for the spotlight briefs that you will hear about today, including USAID staff Anwar Akil, Lisa Maniscalco, Washington Omwomo of the USAID Kenya mission, and Pushpita Samina from the USAID Bangladesh mission. Marcela Zuluaga Martinez from the LHSS project, Laurel Hatt from Results for Development, and Ava Sylvester from Tulane University. I hope the Practice Spotlight series will become a rich and valuable resource for everyone involved in designing and implementing health system strengthening programs. Thank you very much for the opportunity to open today's exciting webinar, and I hope you enjoy. Back to you, Rachel.
Thanks so much, Jesse. I appreciate the remarks, and we definitely share the excitement about the Spotlight series, all the briefs in general, and these briefs today specifically. So looking forward to hearing more. Now we'll hear from Rachel DeLong. So Rachel, over to you.
Thanks, Rachel, and thanks everyone for joining us today. Today I'm going to start us off by talking about a few different things. First, I'll discuss why complexity-aware MURL is important for health system strengthening. Next, I'll give an overview of the HSS Practice Spotlight briefs on MURL. And lastly, I'll wrap up by highlighting a few key considerations about using complexity-aware MURL approaches in health system strengthening projects. Next slide, please. Why is complexity-aware MURL important for health system strengthening? As health system strengthening interventions and systems thinking in general become more common, practitioners need to be ready to monitor, evaluate, research, and ultimately learn from their work. The pathways between health systems interventions and intermediate outcomes of equity, quality, and resources optimization are complex, and these linkages may become even more unclear when we try to connect the interventions to health outcomes. As opposed to more traditional MURL approaches that require a relatively known cause and effect relationship, complexity-aware methods can monitor interventions whose sources of complexity may include a number of these different bullets that you see here on this slide. So it includes things like the involvement of many different stakeholders with different interests and contextual factors that can affect implementation. Next slide, please. The first two briefs in the MURL Spotlight series discuss the practical application of contribution analysis and outcome harvesting. The briefs do a number of things. They provide a short introduction to each approach. They describe 2 to 3 use cases each of health system strengthening interventions using the approach. And they discuss implementation considerations, drawing on lessons learned and recommendations from the case studies and a literature scan that we conducted. The briefs are not normative guidance documents on how to implement these approaches. Instead, they're documents that are written for people who are not MURL experts themselves. These briefs are practical documents that are meant to inform an initial deliberation about conducting an exercise by answering questions such as whether the method could be a good fit for the project or what are particular tips for designing a successful exercise. Importantly, these briefs also then point readers to additional resources and references that provide more detailed guidance on how to conduct an exercise. Next slide, please. The first method I'm going to talk about now is contribution analysis, which tracks progress against a theory of change. So unsurprisingly, it's a good fit for interventions that have a clearly articulated theory of change. The 2 case studies that you see here on this slide are the examples that we highlight in the contribution analysis brief. I'm not going to go into too much detail now on these cases or the ones that you'll see on the next slide, but I do hope that you will read the briefs, which are now available on the LHSS website, and the link to that site is going to be in the chat. The first case study looked at the MQ-Sun Plus project. This global project used contribution analysis to assess the effect of their TA on health systems and nutritional status across multiple countries that they were working in. The project developed their methodology in the first year, and the team collected data continually for their analysis throughout the project. They updated then their analyses each year with the new data that they had collected. The second case study is from MCSP, which conducted contribution analyses of their HSS interventions in 3 countries to help tell the story about the program's contributions that traditional M&E approaches were not able to capture. Today, we're excited to have one of our panelists, Golnoza Usmanova, who was involved in this contribution analysis. Next slide, please. The second brief highlights outcome harvesting, which identifies first observed changes and then works its way backwards from that point to identify how an intervention may have contributed to those changes. The first case study looks at the Communicate for Health project's outcome harvest in Ghana, where the outcome harvest was conducted for the end of project evaluation because it accounted for the nonlinear nature of the capacity development TA that the project was providing. Kama Garrison, who is going to be presenting next, will discuss this case study further. The next project I'll discuss is Circle, which used outcome harvesting in its developmental evaluation of the Brescia Afya service delivery project in Tanzania. The project conducted 2 different outcome harvests, the first in the second year of the project and then the next in the 4th year of the project. Circle had evaluators who were embedded with the implementing partners, and this enabled the team to really get a holistic understanding of the project's progress, context, and pathways of change. Lastly, before we get into some key considerations, I want to acknowledge an additional example of an outcome harvest from the African Collaborative for Health Financing Solutions project, the ACS project. We mentioned this case in the brief, but it isn't included as a full case study because the harvest was not completed by the time we started drafting the briefs. We are lucky today to have Sani Mbaye here with us, and he will be on the panel. Next slide, please. Now I'm going to address a few different key considerations that came out between the two briefs. Through the stakeholder consultations that we held, as well as a literature scan that we conducted before writing the briefs. The first consideration here is that the amounts of time and resources that are needed to conduct one of these exercises vary greatly depending on things like the scope of the exercise, the number of outcomes or interventions that are being investigated, and the number of stakeholders who are involved. We did see a wide range of timeframes for the case studies highlighted in the briefs. At one end of the spectrum, we had the C4H example, which took 6 weeks to complete their outcome harvest. While we want to note that this isn't necessarily a reasonable expectation for a full outcome harvest in many situations, it does highlight that there can be adaptations to make a method more manageable depending on the scope and the available resources. Other implementing partners we spoke with mentioned that 6 months or so might be a more reasonable time frame for an outcome harvest. We also saw a couple of other examples that took a longer time. So in the MCSP, in their contribution analysis, they took up to 1 or 2 years in each case. The second consideration here is that subject matter experts and implementers are both critical members of the team conducting the exercise. While most of the teams that we spoke with did have a mix of both technical experts, implementers, and M&E staff, the people who we spoke with repeatedly highlighted the importance of a sound understanding of the technical content of the intervention, as well as knowledge of implementation progress, including the contextual environment. One comment from our consultations that really stood out to me and I found really interesting was when one of our contacts talked about how these approaches don't require highly specialized M&E skills. Instead, they rely on softer skills that many technical experts and implementers already have. This includes things like conducting interviews, facilitating focus groups, conducting document reviews, and then synthesizing information across all these different sources. The third consideration here is that, particularly given the relative newness of these methods in health system strengthening contexts, the teams repeatedly spoke about the importance of sensitizing stakeholders to appreciate the fact that these are widely accepted MURL methods and that they yield potentially useful results. In the cases, this included the need to sensitize evaluators in some cases themselves, the client, and local partners such as government counterparts. The fourth consideration here is that these methods can complement other M&E approaches or they can stand alone. For example, we saw in Circle's outcome harvest, which was that they implemented that exercise in the context of their developmental evaluation. We saw other cases where the complexity-aware approach complemented more traditional M&E and research methods, as was the case with MQ-Sun Plus's contribution analysis. We also saw cases where the exercise was conducted without a complementary method. Lastly, I'll highlight that complexity-aware monitoring approaches really produce rich data on what's contributing to changes or not. And these findings do have the potential to inform adaptive management and continuous learning. While complexity-aware approaches can be conducted either during or after implementation, we learned from a couple of case studies that unless you plan to incorporate these methods into adaptive management strategies from the beginning, it can be difficult to start feeding findings into adaptive management and learning cycles retroactively. Next, I look forward to hearing from Kama, who will discuss the experience of conducting an outcome harvest on the Communicate for Health project and how some of these considerations that I just discussed applied to the exercise. Thank you.
Thank you, Rachel. Thanks for talking us through those briefs. And for folks who haven't seen it, the links to two different websites, both of which host the briefs, the LHSS site and the USAID site, are in the chat, and we'll repost those again at the end as well. Next, I'm happy to turn it over to Kama Garrison, who, as Rachel said, will be talking us through her experience with one of these specific examples. So Kama, over to you.
Thank you, Rachel. Thank you both, Rachels. And good morning and afternoon to all who are participating. Next slide. The USAID Communicate for Health project in Ghana was a social and behavior change project. And it was part of Ghana's health systems strengthening portfolio. And remove this, I lose my bandwidth. The Ghana mission requested this end of project evaluation, as Rachel said. In addition to promoting health behavior change, which in this case, the project was focused very much on mass media, and it's important in the evaluation. It won't be important to our discussion, but it's important in the discussion, in the evaluation, only because we know mass media alone will not lead to behavior change. But there was also a large emphasis on capacity of the government, civil society organizations at the national, regional, and district level to implement SBC campaigns. So the capacity to be able to design and run these campaigns on their own. Next slide. As was said, this is an end of the project evaluation. Originally, the mission asked the evaluation team to consider the project's impact on behavior at the community level and to use a case control design to conduct impact evaluation. We get this a lot in behavior change evaluation. Eventually, it was mutually determined that this would not be possible because a case control design would have focused on behaviors and missed significant health systems strengthening outcomes of the project that were also of interest to the mission and evaluators. And also there had not been a baseline needed for case control impact. There's also an issue of cost and time that happens with a case control design for such an end of project evaluation. We chose outcome harvesting methodology. Outcome harvesting offered a way to account for the flexibility, fluidity, and as well as the intended and unintended outcomes of capacity strengthening work, as well as a number of unexpected successes from the project working hand in hand with Ghana Health Services. Additionally, capacity development, as we all know, is not linear, and C4H was specifically designed to be responsive to the emerging needs and shifts in the intentions and structure of the government. Outcome harvesting seemed like an excellent methodology for capturing successes resulting from that responsiveness. Next slide. So you might wonder what the process was. As we said before, this was 6 weeks of full-time work for 4 staff. I know that may not be typical for many outcome harvests, but we were modifying this methodology to meet the needs of the end of the project evaluation and the time and cost we had available. We reviewed project documents and identified almost 60 outcomes to which the project might have contributed. I say might because we could only identify, we needed to confirm what those outcomes were. And I will go into that more in a moment. We spoke to almost 100 people, including USAID Ghana staff from the consortium partners, and we spent a great deal of time with government staff, private sector partners, such as creative agencies, and radio and television partners, as well as other implementing partners that had interacted with the project. The project also, just as an aside, had a responsibility to provide SBC support to other implementing partners. So they were an important stakeholder in this evaluation. We reviewed over 100 documents when creating the outcome descriptions. So we started by using the documents as a way to identify what might be outcomes that we would be looking to confirm. And then we spoke to a number of stakeholders to confirm whether those looked like good outcomes. And then I will go into how many times we had to confirm that before we could actually declare it an outcome that we would report on. The documents we referred were things like the original RFA, quarterly reports, annual reports, and work plans, government health promotion resources, mass media campaign documents. We went through all the campaigns that were done, and capacity building curricula, assessments, and tools. The evaluation team then synthesized these findings, grouped them together into outcomes that were confirmed or unconfirmed to be linked to the intervention. We required that the confirmation be at least 3 different ways of confirming, whether we observed it or whether stakeholders that we talked to or key informants confirmed that it happened. So it had to have been confirmed at least 3 times. Many were confirmed many more times than 3 times. They had to be done independently and not prompted. At the end of this evaluation, we debriefed with all stakeholders. Next slide. And what were the findings? There were so many. I just re-looked at the report. It's quite long. But just some of a few findings. As was mentioned, the C4H's project's planned outcomes evolved throughout the project implementation in response to changes within the Ministry of Health. The project was particularly successful in achieving system-level improvements to Ghana's SBC landscape through changes to policy, health management information systems, human resource management, and coordination functions within the Ghana Health Services. Well, a part of the Ghana Health Services that deals with health promotion. This implied potential for sustained results. Based on the document reviews and interviews, the evaluation team proposed outcomes that highlighted the health system and capacity strengthening outcomes of the project as the primary focus of the evaluation. For example, the evaluation determined that C4H's efforts played a role in preparing the government to assume a much larger role in SBC activities in the future. Also, the elevation of the health promotion division from a a unit or department under the Family Health Division to a division under Ghana Health Services, putting it in line with other divisions such as family health, malaria, etc. This has not, as far as we know, happened in other countries. This brought it credibility, and with that, hopefully, funding. Next slide. Here's one small example of the question, outcome, and contribution that was identified. The question being, which capacity building interventions appear to have been most impactful with partners and beneficiary groups? The outcome: in 2016, the National Health Promotion Strategy and Action Plan was published, helping justify elevation of the Ghana Health Services Health Promotion Unit to a division. The intervention contribution: C4H provided technical assistance and financial support for the launch of the strategy and action plan. And technical assistance in this case, I think, is important because it wasn't all typical technical assistance. It wasn't SBC technical assistance all the time. That was a significant part of it. But it was also a lot of management, a lot of, as I said before, policy changes, human resource management systems, information systems. And so it sort of broadened the SBC technical assistance to a much more system-wide technical assistance. Next slide. Some of the caveats and lessons learned. The original outcomes of the projects had to be reconsidered due to the design of the project and changing contextual factors. As I said early on, the original design had been primarily around behavior change through mass media and support to both the government and implementing partners in the SBC needs. Through the review of the documents and interviews, the team came up with a set of outcomes that better reflected the project's successes, both intended and unintended successes. The team also had to decide what would be considered a confirmed outcome. It was decided that 3 independent verifications of an outcome would make it a confirmed outcome. So to be clear, the outcomes were selected through the review of documents and stakeholder meetings and observation. Then those outcomes had to be confirmed independently without prompting by 3 other sources. A key contextual enabling factor was that the stakeholders were quite transparent and willing to share the large amounts of data and documentation needed for the harvest. Now I'll turn it back to the moderators for further discussion. Thank you.
Thanks so much, Kemma. And also a quick note of thanks to everyone putting already really wonderful questions in the chat. We are really pleased at how many there are, and we are going to try to prioritize as many as we can for this next section. So please keep them coming, and we will do our best. Now I would like to turn to the question and answer portion of the webinar. And this will be moderated by my colleague, Neetu Hariharan, also from our Office of Health Systems. We very much want your participation, so please continue with questions in the chat, and again, we will get to as many as we can. Now I will turn it over to Neetu, who will begin with just a few prepared questions for our speakers to get us started. So Neetu, over to you and the rest of our panelists.
Thanks, Rachel. Hi, everyone. Again, my name is Neetu Hariharan, and I'm a Health Systems Advisor in the Office of Health Systems, and I'll be moderating the remainder of this webinar, which we shall kick off with a question and answer segment with our panelists. So before we get started, let me quickly reintroduce who we have on the panel. In addition to Rachel DeLong and Kemma Garrison, we are also honored to welcome Ekpenyong Iknem, the Director of Planning, Performance, and Learning on the Local Health System Sustainability Project, Golnozo Usmanova, who is a part of the team that used contribution analysis on the Maternal and Child Survival Project, and Seni Mbai, who is a part of the team using outcome harvesting right now for an activity under the African Collaborative for Health Financing Solutions project. Again, I'd like to encourage all of our audience members to submit questions using the chat box on your screen. We very much want your participation in the discussion, so please don't hold back. And while the questions are coming through the chat box, I will just get us started and direct my first question to my colleague, Gulnoza. Gulnoza, welcome. So thinking back to your involvement in the contribution analysis exercise that Rachel DeLong described as a part of MCSP, how has using this complexity-aware approach influenced the way your team now thinks about HSS evaluation for current and future activities? Was there anything that surprised you throughout the process, or was there anything that turned out to be particularly important or crucial for the success of your implementation?
Hi, and thank you very much for this very important question. So we have conducted this contribution analysis in 3 countries and 1 country in India. I was directly involved. This was done in 2019. And one of the things which we learned during this conducting contribution analysis is that it requires a proper, planning, and also one of the good thing about the contribution analysis, apart from evaluating the program, it is very useful tool for adaptive management. And now I feel it, especially in the the fast changing situation now currently we are, and majority of the project aimed at improving health system or strengthening health system in line with COVID. I believe this contribution analysis approach will be very useful, where the traditional M&D approaches like quantitative measurement of the outcome may not be quite sufficient to tell the story or to tell about the impact we have made. And one of the another things which we have learned during contribution analysis is that though there are quite a few literature on theoretical aspects of conducting contribution analysis, but how to do it in the in the practice, that information is really lacking currently in the literature. So we that's the reason at the beginning we spent quite some time in terms of planning for contribution analysis, identifying the questions that we would like to answer through contribution analysis. So that was the one aspect which we have learned. And also currently in our majority of our health system strengthening projects, along with the traditional M&D approaches, we are also using some aspect of contribution analysis, and also the other approaches which is important in current situation.
Thank you, Gulnoza, for that very thoughtful answer. I really like the fact that you emphasize that contribution analysis very much serves a complementary role in providing that additional qualitative information that's really necessary to be able to tell the full story, as quantitative measures can't do that alone. And so that takes time and to pull and extract that. So I very much appreciate that response from you. So I will move to Saini for the next question. Saini, your team on the ACS project is actually wrapping up an evaluation right now looking at the effect of USAID investments in resource tracking in Namibia. What was interesting about this evaluation is that your team took a bundled approach, meaning that you used 2 or more complexity-aware techniques with your evaluation plan. Can you talk a little bit more about the bundled approach you all took and the benefits you saw to the program evaluation and stakeholders involved? And can you say a little bit about how these approaches help to articulate the broader system changes, even when initial investments may be more vertically focused?
Sure. First of all, hi, and thank you very much for those questions. However, before answering, I would like to first of all contextualize the evaluation. I think doing that will allow for a better comprehension of the approach vis-a-vis its sought out objectives. I will start by saying that like USAID through ACS, the African Cooperative for Health Financing Solutions, supported both Namibia and Botswana's efforts to optimize their resource tracking methodologies. However, since the evaluation that we are going to be talking about today focused solely on Namibia, I'll just put that section into context of the work and the work that went into the harmonization of Namibia resource tracking methodologies. And I'll start the contextualization by saying that it is like super important to note that Namibia is like a small country, like around 2.5 million people. I think like roughly the size of a small state in, or like even a city in the US. That country gained its independence in 1990. And the young age of that country did not deter its leaders from putting in place policies that enabled the country to gain a somewhat strong economic status. And that economic status allowed or like money or influenced the external donors to pull out from investing in major sectors like the public health. And that decision kind of like prompted the local decision makers, like the relevant authorities, to kind of think about health financing. And the other part is that up until 2019, Namibia was using two parallel resource tracking methodologies. And the purpose of those resource tracking methodologies were to kind of enable the government to know where the funds are coming from, how they are spending them, and what were the outcomes that they were getting out of it. However, with the parallel methodologies, we saw that like, or at least the local stakeholders saw that there were a lot of duplication of efforts, a lot of overuse of resources, which is exactly what those methodologies were aiming at identifying and help eradicate. And fast forward like further in the future, what we did, or like what the local stakeholders did with the support of ACS and USAID, was that like they combined the two methodologies and into a unique methodology called the Harmonized Resource Tracking, or HRT for short. And after that is done, ACS received some funding from the from USAID's Office of Health Systems, OHS, sorry, to evaluate the value add of that harmonized methodology. So to get now into the question that you have asked, we brought together three different approaches that were usually used separately and had them work in symbiosis to kind of triangulate the truth. And I think that's where the innovation lays. And the evaluation framework that we proposed to compose was composed with a process documentation, systems mapping, and outcome harvesting, like triangulating to find what the real value add was. And very quickly, process documentation consisted of documenting the entire process of the endeavor for the ability to learn and adapt in the future for our own project and the others. And just a small parenthesis there, for this evaluation, we were lucky that the ACS project was implementing the PD approach way before we knew about the evaluation exercise in Namibia. And that is due to the fact that continuous shared learnings was, or like is one of the core functions of the project. On the other hand, systems mapping allowed us to kind of visualize the different components of the system, identify the different subsystems within the system, and how they work together, where the duplicated efforts are located in the system, what were the leverage points, etc., etc. And all of that was visualized in a way that allowed everyone, regardless of how well they were immersed in the system, to understand the different mechanisms of the system. After that, it's also important to say that we created two maps. The first map looked at the system before the harmonization, like the two parallel systems. And the second map looked at the system after the harmonization process. And by doing that, we gave ourselves the opportunity to do a comparison between the two maps, and we saw the differences in the system between the two chosen periods. And it's that period, that moment, that outcome harvesting came in, because it allowed us to make sense of the significance of the observed changes. And I'd like to briefly give another definition of outcome harvesting. So Rachel DeLong gave a superb definition of the approach earlier. We defined, or like the approach that we use regarding outcome harvesting is that it consists of looking back in time see what has changed on the evaluand, like what is being evaluated, and determine what or how much of the observed change could be allocated to a given observation or to a given intervention. Like here, the intervention is the support that was done through ACS and USAID. And as such, through outcome harvesting, we gathered a better understanding of the significance of the observed changes, whether the stakeholders immediately affected by or involved in these changes validated those changes that occurred, and whether USAID support through ACS could claim any of the observed value add. In conclusion, each of the evaluation approaches provided us a specific section of the puzzle. And in the end, we had like a clear, complete, and contextualized picture of the whole. And regarding the evaluation process, it was inclusive. We talked with several stakeholders in Namibia to ensure that we were not only triangulating approaches, but also triangulating data sources. We talked with different stakeholder types, and within each stakeholder type, we converse with different members. And I will finish by saying that the evaluation being done during the COVID-19 pandemic was also a considerable hurdle, something to keep in consideration, meaning that we had to do our validation sessions online. And it goes without saying that online gatherings take a toll on the quality and the amount of engagement you get. So yeah, I just wanted to add that. And I think I will stop my intervention here, since I believe I have touched on the main elements of the evaluation. Please feel free to ask any questions if you want me to dig deeper into any part. Thank you very much, and over to you, Nitu.
Thank you, Seni. That was a very comprehensive response. And I particularly liked that you said at the end, what these combined approaches ended up doing is really putting together the full puzzle for you. And I think that's really great. I think one thing that we can take away from this is that these approaches can be combined with other complementary techniques and methodologies within the complexity aware sort of space, and to look and see where we can make those combinations, where we can bundle some approaches to provide a richer picture of what we are seeing and what changes we're seeing in this space. So thank you so much. I think that was a fantastic answer. So I think we'll move to some of the audience questions now. I know we've been getting a lot in the chat, and I've been trying to do my best to keep track of them. But again, please keep them coming in. We'll try to answer as many as we can. I know that there was a question asked earlier, more of a clarification, specifically when Rachel DeLong was speaking. I know she mentioned synthesizing information when they're collecting sort of information on outcome harvesting, and what the difference that is between analyzing. Rachel did respond and say that by synthesizing, it essentially meant analyzing, and that there are a few related points about what is done in pulling together multiple data sources and details to possibly infer a conclusion. But I also will turn this to Seni to answer maybe a similar question, just off of what he just spoke about. These evaluation methods often use the word synthesizing findings that can be tricky in health system strengthening. Any reflections you have on how you did it, and whether you used a synthesis framework or suggestions around how should one do it?
Yeah, if I am getting right the question, what I would say to that, sorry, how I would answer that question is that, first of all, like when you have data coming from different sources, like synthesizing them is like a must. You are like triangulating, having data or like information coming to you from different sources, different perspectives, people being impacted or like impacting the system in different ways. So synthesizing is like primordial. However, when the way we did the synthesis is that we kind of like use different tools, different approaches to kind of extract what are the learnings. If I can take the example of outcome harvesting, for example, we had different learnings from different stakeholders, and we synthesized them. Sorry for using the same word again to explain what I'm trying to say, but like kind of synthesizing them in a way that is extracting specific learnings that some different stakeholders can come in and comment on. And for example, as I was saying earlier, we did the validation session online, and we used a tool called Miro. And with Miro, what we were able to do is that, like, we had the different outcomes, the different learnings laid out, and give the opportunity to each of the participants to give a thumbs up or thumbs down to a given statement. How are they validating that? And I think I saw another question around validation. I'm just going to anticipate on that at the same time. So that's how we did the validation as well as the synthesis. Again, extract learnings to make sure that people are given the opportunity to talk on them. Vote, quote unquote, and see how, if they are agreeing on it, or if not, how they would potentially rephrase or ask us to kind of like change stuff to make it more accurate and mirroring the reality on the ground. So yeah, I will stop there, and if there are any needs to clarify for the audience.
Yeah, there's a lot of also great tools out there as well. I think COVID has brought to bear a lot of new technologies used for validation and synthesis to explore. So we can try to drop a few in just for folks to look through. I think I'll turn the next audience question to Kama. So Kama, someone from the audience asked, how did you verify your findings coming from your initial synthesis? Through another round of interviews, or were there additional literature reviews that you did? And your original plan necessarily involved a lot of assumptions about the system within which your work would take place. Did outcome harvesting lead you to learn anything new about the system in terms of rethinking the nature of the problem? So let me know. Go ahead, Kama.
Thank you. I might have to have you split that one. We'll start with the stakeholder. With the first one on confirming. So the question was, how did we confirm our outcomes? Is that correct?
Yes. How did you verify your findings?
Yeah. So the verification process was done through, as I said before, through independent, non-prompted interviews with key informants. So if we identified an outcome through an observation, or we had a list of, I can't remember at this point how many initial outcomes we had. It was well over 100. I think in the end we had 60. And those 100, that 100 or however many the exact number was through the review of documents, through things we had observed when we first arrived, through interviews with people. To confirm those, we had to either had to be confirmed independently 3 times, and it had to be confirmed by other stakeholders. So if a stakeholder had mentioned something that they thought was an outcome of the project, that stakeholder wasn't re-interviewed later about that outcome. We had to find other key informants that independently also mentioned that as an outcome, and we had to find it in some kind of documentation. So we kept a sort of running tally, and I have often referred to this whole evaluation as a modified outcome harvesting. So of course, I see all these titles of M&E specialists, so I'm just putting that caveat out there that we were looking for ways to verify that never repeated, so you didn't get the same stakeholders, the same key informants, just repeating the outcome itself. It had to be independently, non-prompted, mentioned by another entirely different key informant, or observed by us, or even in some cases had hard data behind it.
Thanks, Kemma. And then for that second part of the question, did outcome harvesting lead you to learn anything new about the system, such as rethinking the nature of the problem?
This is a difficult question. I mean, it's a fun question, but it's a question I could spend another hour or two on, because we learned a lot and had to rethink quite a bit. But one of the more interesting things, the project was housed with the government. And I don't know how much people know about health promotion units in governments, but they are not typically the most well-funded or the most respected. And so just the general state of the place people were working was quite, well, it wasn't workable. And because the project was housed in it, they couldn't work either. And I think in many cases, USAID would just say, well, go find different offices. But in this case, USAID said, no, make it work. And so together, the project and the health promotion unit at the time had to do a lot of infrastructure. And this was when I said contextual changes. This started to delay the project. And it was just basic things that allowed you to work and learn and grow and do the job you were meant to do. And we could not have predicted the domino effect that had. It created pride. It created credibility in the external environment, because the whole goal of elevating HPD was to make them a resource for the whole government Ghana Health Services. In typical health promotion work, a malaria division might have its own health promotion unit within it. So the government wanted to consolidate and make this, they wanted to elevate this to the equivalent of other divisions and make them the go-to resource for all things social and behavior change related. But to do that, you needed some credibility. You also need funding and other things. And so just this working hand in hand every single day, trying to strengthen the infrastructure in which people were working so that they had a functioning office, gave them a whole series of things that led to system impacts around, like I said, pride and credibility and ability to do their job and excitement about doing their job. People were coming to work on time. People were working full days. People were excited to try to push their jobs into new territory, but also others were coming to them because people, places, they had a place to come to use them as technical experts in the social and behavior change space. Does that answer the question?
I think so. No, it is a very hard, tough question. But I think as practitioners in the field, we constantly have to be sort of looking and learning from our system and observing these changes. And I think you all were able to do that. I know we only have a couple minutes left, so I'm going to ask two more quick questions. First, to one of our panelists, Ekping Yang, wanted to ask you what the difference between outcome harvesting and impact evaluation is. And if you can do so, answer very quickly in a minute, that would be fantastic.
Thanks. Thanks, Nitu. My time starts now. So essentially, impact evaluation, I think one is outcomes harvesting is an evaluation approach, and so it can be used in impact evaluation, as one of, as a monitoring technique or as an evaluation technique for impact evaluation. I think the relationship between the both of them can be almost like a subset. In that sense, you can use outcome harvesting as an approach in an impact evaluation endeavor. You know, the kind of slight difference is that impact evaluation, you cannot really have a preset set of outcomes, you know, and then you are investigating or assessing how the intervention affects, so it's connected to those outcomes. You know, sometimes the outcomes might be unintended, it could be intended, but there is an analysis that requires sometimes a counterfactual, you know, and in that sense, if this intervention didn't happen, you know, what's the impact? Well, what is the impact in that sense, in the absence of the intervention? On the other hand, outcome harvesting, as we've heard today, you know, is working backwards from an observed change, from an observed outcome, and trying to collect examples of what affected it, what behavior, working backwards, whether did the intervention contribute to affect these outcomes, and so on and so forth. So in general speak, I would say that's the main relationship there, and difference, of course. Over.
Thank you so much, Young, for that quick fire response. I really appreciate it. And we're just going to have one more question before we wrap up. I know we're bumping up against time, but wanted to give the last question to Golnoza, since many folks have asked if you could provide some examples of findings that emerged from the evaluation that you participated in that would not have been apparent from applying a simpler approach of just writing up a case study. Could you tell us what you think about that?
Yeah, just as a part of the contribution analysis, for example, for Indian context, we have identified 4 questions which we would like to answer through contribution analysis. And to answer those questions, we have used the program reports, as well as we have also conducted some qualitative interview with some stakeholder groups, as well as the program staff. And one of the things we have, for example, the key question was like whether our intervention led to expansion of the basket of family planning methods in our intervention sites. So while we also looked at our, at our program data means the quantitative data. Yeah, we saw that over a period of time, there was a change in terms of the uptake of new family planning method. But to understand, the pathway, what led, for example, when we saw this change, we have also seen that at some point of time, we noticed there was a drop in acceptance. To understand the reason why we have observed a drop and what could be the reason, so that cannot be simply explained by only looking at the program data or doing the case study. So again, in the chat, I have put a link to our reports, detailed reports, which is available online. And due to time of, the limitations, time limitation, we won't be able to go in the details. So I'm just trying to summarize our key results.
Thank you, Golnoz, and thanks for that. I'm going to wrap us up, but before I do, I want to ask all of the panelists if you can just type in the chat box, what is one piece of advice that you would give to our audience today who are interested in applying these approaches to their own HSS program? So feel free to type in the chat box while I close us out. So again, I want to thank everyone who joined us here today, all of our panelists and our presenters here with us and the team that helped put this together, and as well as you, the audience. Thank you so much for joining us. I know we're out of time, but it seems like we've had a really great discussion, and I hope you all have taken away a newfound understanding of these approaches and confidence to apply them in your current or future programming. And while it's always great if these methods can be planned from the start of any program and activity, it's never too late to introduce these approaches into your activities if you haven't done so yet. And lastly, remember that these approaches are meant to be adaptable to your context, and we hope these briefs serve as a good starting point for discussion with your program teams, and you also have found new resources as well as new person resources as well to contact. Again, I'd like to thank everyone who joined in today and all of you who submitted good questions. We're going to try and collect all the unanswered questions and respond to them as best that we can I hope everyone enjoyed the webinar and learned as much as I and my colleagues did. And lastly, the LHSS project will be sending out a recording of today's webinar next week. So be sure to watch your inboxes for that webinar recording and share with all of your colleagues. Thank you all again. Stay safe and have a great rest of your day.